Welcome back and thank you for staying with us. Now, the City of Tshwane says water test results from Temba and Hammanskraal have come back negative for E.Coli and the deadly cholera virus. Officials are awaiting further results from other regions as they scramble to find the source of the cholera outbreak in that area. It's already killed 15 people and left many more hospitalized. The community is angry as they have been complaining about water quality for over a decade now. Affected residents will now receive water tankers deliveries for 5 days a week. Now, Ofentse Madzebatela, he is Tshwane MMC for Human Settlements, joins us now virtually to discuss this further. Thank you very much, Ofentse, for your time here on eNCA. Just firstly, there are residents who've been saying that although water tankers, or it's been announced that water tankers will be out in certain areas, they're saying that they try to go out there and they find nothing.
Good day, Masego, and to your viewers. I can assure you that the water tankers have been on the ground as of since Monday, the 5 days. But what you should also have an understanding of is this. We have two types of water tankers in the city. We have one that is provided by the Human Settlement, which is the department that I am heading as a political principal. And we have another one that is water and sanitation. The water and sanitation water tankers have been in the area every day, 7 days a week. It is only the Human Settlement water tankers that were reduced to 3 days from 7 days due to the financial challenges that we know the city has been undergoing. So we are now also ramping up our water tanker provision days to 5 days in order to deal with this outbreak that we are facing in the area of Hammanskraal.
Do you know, in terms of this report, I'm sure you've also seen it as an executive member of the City of Tshwane, this report that says that there was no E.Coli or cholera found in the water that particularly supplies that community. Do you know how far and wide this investigation would go? Because, you know, I thought, I'm not an expert and I'm not an engineer, but I thought that cholera would come from sanitation and water issues, right? So where would this be coming from? Do you know if the investigation will try and find that out?
Yeah, the preliminary results show that we have not found E.Coli in the tested areas that we have done. So what we have done as a city and the Department of Health of the city and also the Department of Health in the province is that we are widening up the scope now. And today we are also testing furthermore of the water tankers that we are using to provide this water with. This is inclusive of schools, churches, and other areas where we try to find the source. We are also waiting for the results of the NICD that is going to give us their results tomorrow or Thursday in order to ascertain on where the source of this problem is. So until those results come back, we are still in the dark as to where this problem has emanated from. And that is why we are also calling for the community to continue to practice best hygiene practices.
All right. And then when it comes to, you know, what's happening in hospitals, do you know how many people, can you give us an update on how many people are still being treated at hospitals? Has your colleague in the health sector updated you about how many people are still in hospital getting treatment?
Yeah, what I can tell you as of our mayoral committee meeting, I have my notes here. Yeah. We have been told that there has been 133 emergency admissions, and then those who are then admitted into hospital beds is 46. Unfortunately, we have a death toll of 16.
So one more person has died.
We would like to send condolences to those families. Yeah. We would like to send condolences to those families, and one death is already too many. 16 is a high number, and we are really working very hard with the different sectors, especially the scientific side as well as the health side, to really find the source of this situation.
All right, and have you spoken at all about the possibility? I don't know if I know that you would still need buy-in from provincial government and even national government. Do you know at all if you will be considering changing human settlement for the people of Hammanskraal for now while this issue is sorted?
Changing human settlement meaning?
as in like moving them from that area, because clearly it's a health hazard if already now you're announcing that the 16th person has succumbed and investigations are not showing any signs of E.Coli or cholera? So that means you're not finding exactly what it is that is causing this, right? So that means people's lives are in danger at the moment.
Yeah, it's huge. This thing is just beyond Hammanskraal. It's not just confined to Hammanskraal. Even the neighboring areas also, we are starting to see positive tests. So it's a big situation. I don't think that we can move that number of people out of that place. It's not just confined to a particular area in Hammanskraal. Even other surrounding areas are starting to have numbers coming into the Jubilee Hospital. So that one becomes an impossibility. But I think what is important is that right now the Department of Health, both the city as well as the province, have sent out people to do education around hygiene and how to handle food and how to handle your water, so that we lower the numbers. What I can also report is that right now we're just told that the numbers of people that are coming into the hospitals have reduced, but obviously we don't know what is happening at clinic level. So until the clinic level also comes in, we can't really say if the numbers are starting to drop or not, based on this education drive that we have started since yesterday. Already 5,000 pamphlets have been distributed in the area around this area of hygiene.
All right. So do you know at all if the Jubilee Hospital itself is affected, for instance, because of the fact that it is in that particular community? I assume that it uses the same purification process or the same process to get water, right, as the rest of the community. So are you not concerned that the hospital itself could be affected and the water that they use is possibly also contaminated?
No, true to that. We have done the testing on the tankers that are on site at the hospital, and to ensure that they are also not contaminated. And we have gotten a sponsor. I'm not sure if we are ready to disclose the company that is already starting to help us with providing water to the hospital. I will allow the mayor and the MMC of Finance to announce that sponsor of that is providing or filling up the water. They have offered to do so on a daily basis for the hospital.
Would you agree with community members who accuse government, whether it be the previous administration or the current one? They are saying that it's a reactionary government, that this has been a problem for about 20 years now, and it didn't matter who became MMC or mayor between political parties. This problem has persisted, and they feel as though both governments, had to wait for 15 and now 16 people to die before you put your heads together to actually sort this out.
Yeah, I'm in agreement with you on that one. Pointing fingers will not help in this situation. But again, we don't know what has caused the problem. So we cannot attribute it to the water issues, because already, like I said, the water that is there, which we have already declared in 2017 that is not supposed to be consumed, has been tested, and the results preliminarily show that there is no bacteria there that could be causing this outbreak. So, but as far as the water issue is concerned, you are very right. And that is why right now I just came out of a executive meeting with the mayor and the MMC of Finance and the CFO to look at, as we know right now, we are in the process of the annual budget to see how much money we can allocate to this problem. But you must also appreciate this is a huge project. It will require billions and billions to solve. That is why the Department of Water and Sanitation nationally is also coming on board to assist, as well as National Treasury, on this issue. Yes, it's long overdue, and it is unfortunate that it has taken a crisis for us to start reacting on this. All spheres of government, not particularly only on local government, but all spheres of government. And we should really be ashamed of this, all administrations, and but also be futuristic about it and say, let's solve the issue. Digging our heads in the sand will not help. It's time to tackle this head on.
Just lastly, Ofentse, have scientists explained to you where else cholera would come from? Remember, I said to you earlier, there was a cholera outbreak. I think I was still a teenager at the time in South Africa, and we were told to boil our water, etc. It's always been something that we were told comes from water. or our taps.
Yeah.
So have scientists explained to you if it's not in the water where it could be?
Yeah, that would require a scientist to answer that. But
Okay.
as a layman, I also thought it's just only waterborne. But also probably I'm told that also in the food that we handle, how we handle food can also be where we can transmit this cholera.
Yeah, because there's bacteria there. And I wonder, I mean, I'm not asking you this question, but I always wonder if this was exacerbated by load shedding. Maybe things in fridges, you know, the fact that they have to stop
Yeah.
working, etc., is also something that needs to be looked at. Thank you very much for your time. Ofentse Madzebatela, he is the Tshwane MMC for Human Settlement.